We got to jump right in because we have a lot to talk about. Okay, so you, a lot of people are going to like protest every day or 2 and 3 times a week. You should be isolating or quarantining after every protest.
Yeah, so after protesting, it's going to be very important to have some type of isolation from our loved ones so that we can make sure that we're not exposing them. So if we're going to choose to go to protesting, it's going to be very important to choose maybe 1 or 2 of those events to go to so that it's not a constant exposure every day.
Now, does it make sense to get tested before you start down this protest or Club Rona road, so you know before you start this process whether or not you are asymptomatic?
It's a good question. In general, just kind of like wondering if you're carrying it around, it comes up to a lot of people. I think before you go to a protest, if you know that if you've been good about wearing your mask and you haven't been exposed to someone and you haven't been having symptoms, you can consider going. But honestly, it's not feasible to have everybody tested in that way beforehand. I would advise people to consider doing a test after you've been to a protest, because we are seeing people being positive after protests. But one thing that's to keep in mind is this asymptomatic thing. So people can be without symptoms. You can actually carry the virus, shed it enough to give it to someone else, but your body didn't react or get sick. The other thing is that you could just not yet be showing symptoms. So you're having what is the incubation period for the virus. You're in the pre-symptom stage, so that you're not going to be having anything. You think you're fine. And then a couple of days later, you start being sick. You're like, oops, everyone I was around before now has been exposed if I wasn't wearing my mask and keeping my distance. And the other thing is that sometimes you don't know that the mild symptoms that you had was the coronavirus. You might just have a headache, and that was coronavirus. You might just be feeling tired all day. You might just had some nausea, or you might just had some diarrhea. So you can have these less common and less thought about symptoms, and it actually was coronavirus because your body fought it off enough for you not to be extremely sick, but you weren't able to stop from spreading it to other people. You're still shedding the virus. So it's something to think about.
And now here we are at the beginning of summer. I mean, we're at the warm weather time period. Folks have been in the house for months on end. Some folks can't resist the urge to get out. They call it Club Rona, call it whatever you want. Whether you're protesting or you're partying, folks are going out. I saw a woman with a mask the other day that had little Swarovski crystals on it or whatever, but reality is our folks are going out. Good idea, bad idea. What do we do?
Well, when it comes to communities coming together, we've been locked up for quite some time due to social distancing, and that plays a role. When the weather gets nicer, people want to go out. One of the things about getting out, it's a way of communities coming together in solidarity, which can be a positive thing. However, it's still very important to be mindful of making sure that we're wearing our masks, making sure that we're distancing ourselves about 2 arm lengths apart, which is about 6 feet, and making sure that we're sanitizing, maybe wearing gloves if we're going to be touching a lot of things and we don't have sanitizer available, and having those multiple masks, as previously mentioned, so that if they're becoming soiled, that they can be replaced so that we don't, increase risk of exposure and transmission. So it's very important, if people are going to be congregating, to still have social distancing in place, even if outside. But if we're going to be inside, that's especially important because there's not as much air ventilation that's going around to help disperse those droplets away, so that could increase that transmission rate. So if we're going to be inside, that's extremely important. And outside is also just as important, to make sure we're masking and make sure that we're sanitizing frequently, washing our hands as frequently as possible. And it's okay to have some type of conversation with people, but we don't want to be out partying till 2 a.m. while still being around large groups of people. That can be dangerous for ourselves and for our families that we're coming home to.
And, there's some other cultural factors here as well. I mean, I was in a situation the other day. I ran into someone that honestly, with their mask on, I'm not even sure who they were. And it was like, girl, come on over here and give me a hug. And I'm like, no, 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 I'm social distancing. But that's our culture, you know? And I said, no, 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 I'm social distancing. And her reaction was, girl, you know, I don't believe what those doctors say. We still have that basic mistrust of the medical community.
Yes, mistrust is a very big issue. You know, there's a history of mistrust coming from communities of color, and that's very important to be aware of. However, it's also important to realize that we have a lot of minority health care practitioners that are here fighting for us and advocating for us to make sure that we're receiving truthful information and that we're receiving the best quality care possible. And I urge our community and our people to listen to what healthcare practitioners are saying, because we, as a whole, Black and people of color, are at a very high risk of transmitting this disease and becoming infected due to various issues, maybe social factors, maybe previous health conditions that are already existing, those underlying health conditions. There are a lot of things that can contribute to that, but we have a lot of minority physicians, nurses, public health professionals that are here, that are doing the research, that are doing the work, and are here for you and are here for our people. So it's very important to try to trust those that are here for us and advocating for us in the best way possible.
All right, we're going to take another break. So if you are going to protest, there are some ways that you can approach it, some things you can do in planning to keep yourself safe. I want to touch on some of those symptoms again, because they've kind of changed over the time as well. What we heard originally is a lot different than the things you just mentioned. We have a lot more to do, and the Lynne Hayes Freeland Show continues, so don't go away.